All right. Welcome to another episode of the Legislative Lens, Spotlighting State Laws podcast. I'm your host, Tim Wilkins. Here we go. Another topic, another bill. Let's have some fun. House Bill number 617 out of the Texas Legislature, 88th legislative session. All right. This topic, pretty straightforward, pretty clear as day. It is a pilot project for rural healthcare employees and workers. And what this pilot program does helps create emergency healthcare. It helps emergency healthcare workers to talk to while the doctors, while the ambulance is in transit to the emergency room. Secure video calls and wireless patient monitoring will be installed in the ambulances in West Texas. This program is boosting a pilot program as well from Texas Tech University Healthcare Science Center. So let's talk. That sounds like a pretty straightforward thing, right? It would be beneficial to the citizens of West Texas to have these initiatives in this pilot program because sometimes emergencies happen far away from the hospital. So this particular law will help a lot save lives while in transit. Okay. Not to say anything derogatory towards our colleagues and our friends and families to the west, but what this does is it allows emergency paramedics and emergency personnel to communicate to the ambulance from the ambulance. Well, back Betty, bam. So if the ambulance is already in transit with an emergency victim, they can actually speak to the doctor via video conferencing and also have their vitals being monitored or wirelessly so they can see these things. So this is a pilot program taking place in West Texas out there in Lubbock. And a lot of the area that it's taking in this pilot program is really, really important because of the time it takes from, let's say, where the emergency occurs to where the hospital might be is a good length of way, right? And so while doing this, it's really going to be difficult. So when this law was spearheaded by a Republican state senator and state representative, I apologize, Mr. Drew Darby of San Angelo, and it's really a straightforward program in my view. It's also very impactful of the lives of West Texans. This law allows a physician participating in the program, which I would assume would be completely 100% participation rate, to review the patient's condition and symptoms remotely. That would make a recommendation on how the ambulance crew can treat them until they get to the nearest treatment facility. Advocates for the program are hopeful that it will close the gaps of people who travel or live in a far-flung corners of Texas and will drive a considerable distance if they are sick, injured, or dying. All right. So at the core of this, the legislature is also investing more programs for other parts of the state as well. But this is the first one because of this is probably the major thing as well because of the West Texas infrastructure and the major transportation zone, and it also has oil and gas production and injuries, and there's a lot of mechanisms there that are very important. People get hurt, unfortunately, they're catastrophic, and they need, the first hour of care is considered the golden hour in many medical fields. They consider this to be the very most important thing. And so if they can get contact with a healthcare professional, and while they're, of course, in transit, it might have a better chance of saving their life. And that's with this program, they're hoping to reduce. This is where it's coming down to. Really comes down to is by the name of James Benenkamp. He's the chairman of the Commission of State Emergency Communications. This program is going to be really really important, and really, it's going to help out a lot of citizens in West Texas. So when they first rolled this out, the first iteration of the program wasn't considered a pilot program or something new. They were just trying to do things to help out the cause and reduce fatalities in deaths, and actually they found it by it reduced fatalities by 1/3, and it's really significant. So when this program first started, however, uh, Benton Camp was surprised to see some EMS providers hesitant to join. It was mostly had to do with protocols in place from 1960s. So they had some dated protocols that were in place. But once they rolled out these new protocols, it really, you know, it's really important. So the act will go into effect, which it did go into effect on September 1st. And the program is actually being paid for by the fees collected on certain telephone accounts that pay for 911 services. A fiscal analysis prepared for lawmakers expects to cost about $250,000 a year for the next 5 years. With the program starting up, it'll likely be in the Trans Pecos region again, with the goal of building it so rural communities can adopt the practices across the entire state. So, really, at its core, at its forefront, let's get down into this. It's going to cost the state about $250,000 to roll out a technology piece that it can save lives. I think it's a no-brainer. Um, it's pretty straightforward, as straightforward it could be, right? It's let's say how we say it here. It's important, I think, that paramedics and technology, especially in the day of technology, that important, people incorporate that inside and hopefully save lives doing it. So this is a pretty straightforward bill, if you ask me. I obviously discussed a couple of the people that helped write it. It was over, I think if you look at the bill track on this, it was sponsored by Alvarado, Clarity, Darby, Herrera, Langley, Morales, Blanco, and Sparks was the sponsors on it. And it passed almost unanimously. Vote wise, it was 142-2, 5 absentee, 1 abstention, and it was really it's a no brainer if you ask me. Vote passed officially on 5/22. 5/23 is when the reportage of the House and the Senate voting, and it was given to the governor on 6/12 and went into effect on 9/1. So hopefully everyone out there in West Texas is, if you're in need of an ambulance or a paramedic, that you're being treated with this pilot program, and hopefully it saves lives. Appreciate you joining me as always. Hopefully keep on this journey of season 1 in Texas. Thank you so much.